More than 500,000 New Mexicans are currently eligible but waiting to get the vaccine. Today, the state's top doctors say supply is quickly becoming an issue. Here's News 13's Brittany Bate.
Kim, the initial vaccine plan expected to move through each phase in a couple months and get to the general public by early summer. But today, the state started backing away from that timeline.
So we can vaccinate up to 30,000 New Mexicans each week. But if you look at what the demand is compared to the supply, we ultimately need more vaccine. And we are advocating for more vaccine, but it may take several months to vaccinate currently eligible populations based on our current supply.
Today, Dr. Tracy Collins, Secretary-designate of the New Mexico Department of Health, said that nearly 800,000 New Mexicans are currently eligible to get the vaccine. That is people in Phase 1A, like healthcare workers, as well as the first two subgroups in Phase 1B, people 75 or older and people with pre-existing conditions. Collins says on average about 7,000 New Mexicans are getting their first shot every day. And once they are all vaccinated, which again Collins says could take months, then the state will move on to the next subgroup, which includes teachers and grocery store workers. Dr. Collins says they are advocating for more doses, but that the entire country is after as much as they can get. And when it comes to COVID in New Mexico, Dr. David Scrace brought back familiar maps showing the state is making progress as new cases and finally hospitalizations are starting to fall.
Our feeling that this downward trend is real, and we hope that you will all partner with us in sustaining it by maintaining those COVID-safe practices.
Dr. Scrace says for the first time in months, some hospitals have a double-digit number of beds available for coronavirus patients. And he says statewide, the test positivity rate is finally not in the double digits, now sitting at 7.3%, close to the state's goal of 5%. Kim, back to you.
Okay, thanks, Brittany. Now, Dr. Scrace says the daily death count may not go down until we hit February 6th or 7th when we catch up with the drop in cases.